Perfect. So it looks like we're at 2:30 now. I can see a couple of people just joining. So welcome everyone. This is our webinar for today is about the CDP members monitoring COVID-19. And so we have two of our members here, Dr. Perna Bassine from the City of Toronto and Alison Garretts from the town of Banff, as well as CDP's own Jamie Carrick, who will be showcasing the Community Recovery Dashboard. We also have today with us Mary Clark from the CDP, who I'm sure many of you have met before, as well as Michael Dietor, who I'm sure as well many of you are familiar with. And I'm Sasha Mosky. I actually just joined the CDP at the beginning of May, and I will be the new face of the webinar. So excited to meet you all as we go through the session today. So we have the order today will be Jamie will present first on the CDP dashboard, and then we'll have Dr. Perna Bassine from the City of Toronto present, and then we'll follow with Alison. And so we'll have time for questions kind of throughout all three sessions today. So I invite everyone to ask questions in the chat or raise their hand, and myself or Mary will be monitoring and watching for your questions. So without further ado, I'll welcome Jamie to present for us first today.
Okay, can you see my screen?
Yeah, you're all good there.
Great.
Jamie, if you click on the bottom of your screen on that little book, instead of this, sorry, the little book, yeah, click on that one.
Bear smash.
There you go. That's better for us. Is that okay for you?
Yeah, that's good. Thanks. Okay, so I'm Jamie Carrick. I'm a data analyst with the CDP, and I'm going to be presenting updates to the Community Recovery Dashboard. So first of all, in case you're not familiar with this, the Community Recovery Dashboard, it is a monitoring tool for medium and long-term COVID-19 recovery, and it uses data primarily from the 2016 census to provide a snapshot of communities across Canada prior to the pandemic to help assess their vulnerability and capacity for recovery from the pandemic's impacts. And so we chose census data because it provides the level of granularity we wanted and allows us to do a lot of cross-tabulation, which was important for this dashboard. And it'll ultimately be comparable with future census data, which is part of our larger plans for the dashboard. So we selected indicators in to show in the dashboard that we've determined to be related to COVID's health and economic impacts, such as place of work, commuting, and vulnerable occupations. We compare these against demographic group data that have shown to be disproportionately affected or have the potential to be affected by the pandemic's impacts. So we've chosen to present this dashboard in Tableau because it allows us to do the kind of heavy lifting or the work of data prep, which can be quite time consuming, and then provide data to our users in a format that's already clean and presentable and hopefully easy to use, especially for those without the technical knowledge to get the data they need out of a lot of the raw data sets from our catalog. So the Community Recovery Dashboard is available in the CDP catalog for all users, and all that you need to use it is the free Tableau Reader software. So I'll give you a little history of the dashboard. Version 1 released last October, and it focused on for that version, we focused on having a comprehensive set of indicators, but the geographies in that version were limited to just census tracts. And just want to point out that back then we did a webinar with kind of an overview of that version 1 that shows the basics of using the dashboard. And so that's kind of a good introduction to the dashboard if you're completely unfamiliar. I'm not going to go as in detail into the basics today. So if you want a little overview, I would recommend checking out that webinar. I'll post these slides on the webinar page later. It'll be slightly out of date, but a lot of it is still applicable to version 2. So version 2 released in February of this year with some substantial changes, which should be a significant improvement in the dashboard's functionality and usability. And like we did with the previous webinar, this presentation will be kind of a formal introduction of the version 2 and a demonstration of its changes. So I'll be doing a live screen share later to show you the changes. And so it'll be for those who haven't, who are new to the dashboard or who haven't kept up with the changes or just want to see these changes in action. So just to give you a little overview of the changes before I demo them, we've expanded the selection of geographies from just census tracts to 6 different levels of geography now. I've made a lot of general layout improvements throughout to improve the consistency of the design and the readability and navigation in the dashboard. There is new demographic data that's now included throughout. And we made changes to improve the functionality for comparing geographies in the dashboard, especially at the census tract level. So now I'm going to switch to a screen share of Tableau so I can give you a live demo of the dashboard. Okay, so this is the community recovery dashboard. Now,
Jamie, from my end, I'm having some audio issues. Is anyone else experiencing that?
Yes, me too. I can't hear anything.
Yeah, he cut out.
It looks like Jamie's just trying to rejoin the meeting right now.
In the event that it doesn't work, I don't know if either of you have, I'm just opening up a version of the dashboard on my computer. Okay. And if you can't connect, then I can do a quick tour. But to fill the time, Jamie's made a lot of great changes from version 1 to version 2. A lot of it based on feedback that we received from you. Particularly, is focused first on census tracts. We have census subdivisions in there as well. The whole suite essentially of standard geographies are available in the tool. Sorry, it's taking a little while. I don't know if it's taking a little while for this to load. The one thing with that Jamie might be experiencing as well is that the reader file is rather large, and you have to make sure that you are updating your version of Tableau Reader somewhat regularly. It's at least once or twice a month. The tool, for those who haven't seen it, is divided up in sort of a storyboard format with various indicators split up by various themes: income, demographics, employment. Let's see.
Mike, why don't we move to Perna now, and then hopefully Jamie will be able to join the call by then.
That's a good idea. Great.
Okay. Perna, is that okay with you? Are you able to stand in?
Yeah, why not? Gotta do it sometime.
Yeah, get it over with.
Yes. Can everybody see my screen?
Yep, you're all good there.
Super. Too small to read? Make it a little bigger. Better?
Yeah, that looks good.
Cool. So we were hit with a problem when we started COVID planning. And hi, I'm Prerna. I work as a planning analyst with the Social Development Finance Administration at the City of Toronto. My team basically is a research information management team. We are supposed to answer the methodological evidence-based questions based on research or data or policy data or programmatic outcomes, whichever comes with respect to whatever we are answering. So we were hit with a question as to when the COVID hit, our food banks went into the action mode, and the city funded a few organizations to provide food on the ground. And then the food uptake from was spotty, and when the new wave hit, we were supposed to plan in a way as to where should they put up new food kiosk, or what kind of food demand projection wise were they looking into. And so for that, we started planning to understand based on the very few weeks of data that we have had, or the retrospective data that we had seen in years with Daily Food Bank, Red Cross, or any other organization who volunteered at that point to provide us with data as to see how when the city situation changes, how do we look into how the food demand changes. And based on that, I came up with a very simple model on to understand where in our neighborhoods is the demand, or projection wise is the demand coming up or would be coming up. And that is where community data programs data came in really handy, because I kind of projected based on how many people were unemployed or low income or seniors, activity limited, and all these indicators were used as factors to these projections, or this what I call this model. And I'm gonna, because one major part of this document is confidential, I'm gonna move past a lot of pages very quickly, but the parts that are not, I'm going to show you. So basically, this was my theoretical piece on whoever was receiving this document as to what kind of indicators we used, how we used them. The good thing was that at that time we had started getting in data of COVID rates on those neighborhoods, so we started putting them alongside these equity indicators as well. And the equity indicators were seniors, unemployed, immigrant population, people who were living alone, and low income. And this is what came up when we projected as to what kind of food demands we were looking at. So basically, if I was trying to project based on all these social indicators, the food demand that we had seen over the years and COVID rates, the red lighted areas were where we should start. At that time, that was, I think it was back in May or June, where we would be seeing higher demand as time moved by. And as in any statistical model, population was held constant and immigration was held constant, this is what you would be seeing in next few months. So that kind of projection model was put here. The methodology was something we borrowed from the business marketing technique, which is called customer segmentation, and the projection model was simply based on factoring all these indicators together. So ranking high on these social indicators was one of the major factors why some of the neighborhoods would become priority neighborhoods, and then adding COVID rates to it and other social indicators, and then food demand pattern. That is how, so that's how, this is oversimplification of the methodology, but that's how I would say it. So these were percentage of populations being served if the neighborhoods are clustered together based on these equity indicators. So we just so basically the customer segmentation technique does something like it clusters most of these neighborhoods together based on commonalities of all these social indicators and the demand pattern that it sees. So we kind of divided the city into low, medium, high need. And by we, I mean this was a projection model. Now, how much of it was actually put to use? Never had that kind of outcome analysis or programmatic outcomes. So this was more of we trying to tell them how to plan. It was a COVID planning kind of a thing. How much was it? How much of it was used? We still haven't heard back, or and I'm quite sure I'm not going to hear back as well. But it's been a while as well. That's another thing. So populations being served. So kind of most of this was a validation technique for us to understand that what we were projecting, are we actually serving the people we wanted to serve based on the equity indicators? And kind of most of these indicators show that if we actually go the way that we are going, if we project this way, if we look into our neighborhoods this way, we could be actually looking at helping or feeding 40% of what we call not only the high need neighborhoods, but also the equity seeking populations or equity deserving population, as the terminology would go. This is how I tried to understand that if we were helping if our analysis was going the right way. So this is a simple cross tabulation between what we found, low need, medium need, and high need neighborhoods, and what was the mean number of immigrants in those neighborhoods, and what were the mean number of people who did not work, people who were living alone, or seniors. And if you see, there is a pattern there. So in our high need neighborhood, the numbers were mostly higher than the previous. Were they statistically significant? Medium need to high need, sometimes we did not find statistical significance, but from low need to high need, most of these were like at least 3 times higher. So you would be seeing at least 3 times more immigrants being impacted if we serve more food in what we call the high need neighborhood. And I can't stress enough that, again, it was a projection model. A lot of these assumptions were based on marketing techniques and health, and we borrowed from health field as well. This is a very simple graph for me to understand. So this is a 3-way graph. It's what you see as food uptake, where what you see is here is the COVID rates. So I kind of try to understand if COVID was divided into four pillar scale, and the uptake of food was divided into another 4 pillar scale, what kind of population we were serving, and kind of where those neighborhoods where COVID rates were high and the food uptake, if our projection model were that and our food uptake would be high, we could be serving about 65% of immigrant population, like those neighborhoods that have high immigrant population. So that this yellow part needed to be high at that end, and the blue part needed to be lower. So here you're saying that COVID rates were low, and we're not putting in that much resource, so low food uptake as well. And there we might be, so these are those 81% neighborhoods where immigrant population is low. All of this was the validation, and these are notes I wrote for a better understanding of what we were saying. I mean, I can go on with each indicator that I mentioned, but if there are questions, I'm happy to take them right now, because they're like 6 indicators and I can keep talking about this. So I'm good to talk, but if somebody has questions about it, please go on.
Yeah, that's a great overview. Something that came up for me is were you sharing this information with food bank providers in the city?
Yeah, this was shared between our division, the food bank providers, and public health. to understand that how COVID rates across their neighborhood, like the neighborhoods that they were being divided into, they were the ones who gave us COVID rates, so we kind of had to share it back with them as well. Yep. It's a very closed group. People who were planning for it. So the food banks that were looking for this kind of planning, my division definitely who wanted to pump in money, and Toronto Public Health who gave us the actual rate on COVID rates. So this was my redacted version. You won't see any real numbers except for the ones that Community Data Program provides us. So those numbers are left on the board, but actual COVID rate numbers will be missing from this one. And this is for percentage of people who were living alone. So our target was to have higher percentages here and here. That means the model was working or it was valid. I think I did one more cross tabulation at the end. In kind of food distribution table on, once some real-time data came in, we tried reassigning these neighborhoods with low uptake, medium uptake, and they were quite, I would say 94% of our neighborhoods actually fell into the same categories that we had predicted them to be. And so when we analyzed them that way, our trends actually remained the same. So we were still serving higher number of immigrant population or people who did not work. And that kind of validated the model and the projection as well. So that's where Community Data Program numbers actually came in handy. And because I'm sharing it with this table, those numbers have been left on board. Otherwise, we had to redact some of them before we sent them out.
Yeah, that's great. Thank you. If anyone has any questions, feel free to put them in the chat.
And can I stop sharing?
Yeah, sure. I'm going to maybe have a bit of a discussion.
Sure.
Is this the sort of first of its kind for the City of Toronto? Has this sort of modeling been done in terms of looking at food security?
I think food security table came into being post-COVID while we were planning for COVID. So I'm gonna say at least this one would be the first of its kind.
Do you see it as a tool to be used going forward as well?
Yes. No. Since then I've projected for more for daily food bank. I'm trying to project for our PRS now going forward. But yes, since then I've definitely projected for more. I just used our CDP numbers to project for daily food bank next 10 years. We'll see how well that projection was done in the coming years, in the coming months actually. But yes, that's why that's where I see value in being a part of this program. The numbers are available, they're very well defined, the geography, and they're customized for us. So it's a quick download and a wonderful system. It kind of works very well for me at least.
Yeah, that's so great to hear. Thank you for sharing your experience. I don't know if anyone else has any other questions for Purna. Okay, well, thank you very much. It was great to hear about what you're doing at the City of Toronto. Jamie, I don't know if you've made it back into the meeting.
I'm back. Thanks for covering for me, Purna.
Anytime.
All right, I will jump back in where I left off, which I think I was just starting to do the live demo of the dashboard. Okay, so yeah, this is the welcome page, and it kind of introduces you to the dashboard. And it also has these navigation buttons because the dashboard is now organized into different sections. So there's one section for census tract geographies, and then all the new geographies are in the census subdivision, another geography section. And then the data sources and COVID-19 data links are not grouped in with the rest of the data now. They're on separate sections. So I'll start by showing you the census subdivision and other geography section. So this section basically forgoes all the map and comparison tools in the census tract section, but which instead allows us to include several different levels of geography. So now included we have Canada, provinces, census metropolitan areas, census agglomerations, census divisions and subdivisions. So you can now view any of these geographies, and they cover all of Canada. So the way you select a geography is you choose the level of geography you want to view. And then in the geography dropdown, all the options for that will be listed, and then you just choose the one you want, and then it'll generate the profile for it. And for the levels of geography with more options, you can use the search to search for the one you want. So the census subdivision section, or this section covers all the same data as the census tract section. So it can show you the same data, but a larger scale, and also provide a point of comparison or give you some context for the smaller scale data in the other section. And you'll also notice in this section the new explanatory text, which is another change. So this text is included all throughout the dashboard and all the pages, and it provides a little bit of context on the data on each page, and some explanation or instructions for the functionality of that page. So for example, on this page, we've got there's a paragraph that tells you how to select the geography to view. So the goal is to make the dashboard a little more self-explanatory, so you can just kind of open it up, and if you're lost, you can read the text, and hopefully that'll give you enough to understand what's happening in the page and then make use of all the functionality. So also on this page are the new youth and sex demographic groups. So these are available throughout the dashboard for any of the sections where you're able to cross tabulate by different demographic groups. These two options are now available. So now let's give a little quick look through the sections of the dashboard. Won't go into too much detail, but just to show you remind you what they look like and point out anything new. And so each of these sections covers a different topic related to the pandemic recovery theme. So employment identifies sectors with the highest employment in a region, and the level of employment loss they've experienced, as well as the COVID-19 exposure risk for those occupations. So you can now find a more detailed explanation of these indicators in the text here. And also note that this data is only at the census subdivision level, just because that's the data we have available to us right now. The housing section shows housing suitability, which is a measure of overcrowding by demographic household types. So it lets you identify like a household, like demographic groups in a region that are disproportionately experiencing overcrowding, for example. And you can also get a sense of the average household size in a region. Commuting shows the mode of commuting used by populations and compares them across demographic groups. So previously we used pie charts in this section and tried to show all the demographic groups at once, but we've rearranged things a bit so that it uses bar charts now, and you now select the group that you want to view. And this lets you do a much more detailed and easier to read comparison of comparisons within demographic groups. So for example, you can compare the percentage of non-immigrants that commute using public transit versus recent immigrants very easily now. And included in these options are the new sex and youth demographic groups, so you can compare these across these different age groups or between male and female population, for example. Place of work functions exactly the same as the commuting tab, but instead shows places of work. So you can see, for example, the youth population that work from home or similar cross tabulations. And then income, again, functions the same as the last two tabs, but it shows the different income stats, so median income, after-tax income, and then you can see as median and averages, and then low-income population as well. And then the last section is collective dwellings. So this shows the population living in collective dwellings for the selected geography. And then it shows the types of dwellings as well as the age groups and income of those populations. And then there's an extra bit of functionality built into this section where you have the types of dwelling listed here, and then the age groups and income here. And then if you click on one of these, then it'll filter these. So if you wanted to see the age distribution of the population living in nursing homes, for example, you could click that and then it'll filter these. And it will also show you the income distribution. So now I'll go back to the welcome page and give you a little look at the census tract section. So covers all the same data as the previous section, so I won't go into as much detail, but I'll just talk about the improvements to the functionality for comparing geographies that's now included. So now all tabs in the dashboard include these bubble charts, which are basically a method for comparing geographies. Each bubble represents a geography in the city you're viewing. And so lets you see the spread of data, and then also clicking on a value will highlight it so you can see where it sits among the census tracts in that region, and this line represents the median. So you can compare the values to the median. So previously, not every tab had these bubble charts, but they're now included in every tab. And in this tab and the employment tab, the bubble charts will show you whichever indicator you've selected to view on the map. And then in the rest of the tabs, they show they're fixed, so they don't change depending on what you're viewing on the map. And so now there's a little bit of an explanation for bubble charts in the text on this page as well, in case you need a reminder of how they work. And another big change is that you can now view percentage values on the map. So instead of just seeing the number of people in each census tract, for example, that is aged 65 years and over, you can see the percentage of the population in each census tract that is in that age group. So it makes it a lot easier to compare between geographies. And one thing to note is that just because of a Tableau formatting limitation, it shows the values as proportions rather than percentages. So it's on a scale of 0 to 1. But it still allows for the visual comparison, which is the most important thing. The colors are the same, and the distribution of the bubbles is the same as it would be if they were shown as percentages. So you can still do that visual comparison. And bubble charts now also show these percentage values. So if you're viewing a percentage on the map, then it'll show the bubble chart, but also in the tabs that have fixed bubble charts, they now include percentages as well. So that covers the changes to the dashboard. So I'll just quickly go back to the PowerPoint slides, and I've got a couple more. So we have plans right now for version 3.0 of the Community Recovery Dashboard, and work is ongoing. And the next version will be focused on adding new indicators, which include work from home potential by occupation and an employment time series. And then beyond version 3.0, our bigger plan for the dashboard is to eventually add the 2021 census data when it becomes available. And this will allow us to have a second snapshot at a second point in time later into the pandemic, and it'll be a point of comparison against the data that's in there right now, so we can show change. So obviously this is probably a fairly long ways off because we have to wait to receive the 2021 census data, and then building it will take some time as well. But that is our big plan for the dashboard, is to have these 2 points in time in there. So as always, we're looking for feedback on the dashboard. So if you have any you want to share right now in the chat, or you want to email us later, feel free to do that. Or if you have any questions about the dashboard, and I hope that you'll give the dashboard a try. So thanks for listening.
Thanks, Jamie. Does anyone have any questions or any immediate feedback for Jamie about the community recovery dashboard?
I just wanted to say it looks amazing. I texted Mary and said I'm embarrassed I haven't checked it out yet, but it is it's awesome. So from my end, from a small community perspective, I'm really looking forward to digging into this. My one question is there capacity to pick up and actually embed in a report one of the visualizations from the dashboard, or like a downloadable element, or how would that work?
Well, Tableau lets you export parts of the dashboard as PDFs. I think maybe as images too. So if there's a section that you want to export, then I think I can't remember exactly what it is, but there is something that you can click that'll let you, export image, story, export image, and that'll export an image of the story. So that'll let you embed it into presentations.
Great, thank you.
You're also able to export the data from some visualizations, no, Jamie?
I don't think that is possible in the current version of the dashboard. Tableau is a bit inconsistent and with its how it works for exporting data from dashboards. And I think right now that wasn't our main priority, so we didn't include that.
Jamie, I'm curious about the work from home potential indicator. Can you speak a little bit more about how that's measured?
Yeah, Mike might actually be able to answer that a little better. But basically they've assigned work from home scores, or it might be like a binary, like yes or no thing for different occupations. I think they've assigned them to NOC codes, National Occupation Classifications, and so the idea would be to, like we've done previously, showing the top occupations in a region, you could, instead of just comparing that against like employment loss, another option would be to compare it against whether those occupations have the potential for working from home.
Yeah, that's pretty much it exactly. I think it was based on Statistics Canada gave us these, that binary classification of the NOC codes. I think it was done in collaboration with a group in the States. So there are some values that are between 0 and 1, where it's kind of an average of NOC codes that don't correspond perfectly to the, I can't remember the name of the American classification system, OSET. Anyway, but yeah, that's it.
Thanks, Mike. There is a question, Jamie. Beth Wilson is asking if the dashboard is available for public use.
Well, right now it's I guess it depends what you mean by public use. It's like it's available for use by all CDP users right now, but it's not available to the public.
That's great, thank you. Does anyone have any other questions, or does that answer your question, Beth?
Oh, thanks very much. This is really interesting. I wonder if you have any plans to make it available publicly. I could see that a lot of nonprofits, for example, would find it really useful, and it's something we could promote. Or do you think it'll just remain among CDP users?
I don't know if we have plans right now to make it publicly accessible, but it is might be something worth considering. I mean, I don't know, that might be something we could discuss in the future. So thanks for pointing that out.
It is it is quite a huge repository of data. So it's actually just the sort of example that we give to our members of the types of things that we would not want them to share widely, like say beyond the bounds of their own consortium, as it would serve as a disincentive to membership. This is pretty much everything that some organizations might want from the program and wouldn't really need to join when we are, in some cases where we're trying to promote membership. I can't imagine that we would be able to make a tool that has such a huge amount of our catalog available publicly. So
I think it is a good point, though, that you can export images or like specific data points and use those as for sort of public-facing documents.
Absolutely, yeah. We would essentially be asking all members to use this as you would any other CDP product, and just consider what is being published. And certainly, we want our members to be able to have public-facing documents and resources that come from the catalog. But if you are publishing something that extends beyond the boundaries of your consortium, or could be seen as a disincentive to membership in another consortium, then that becomes a problem for the consortium model.
Allison?
Hi. I just wanted to add to Mike. I agree with you. Like, I see this as a real value add to membership. And I mean, personally, from our small consortium, we've been having members drop off, as of late. And just seeing this is what I've been hoping for, sort of dreaming for, like that we could eventually have this. And now that it's here, once this pandemic is behind us, hopefully, we can really make some concerted efforts to push and get membership back up again, because this is I see this as a user-friendly tool, but I would say that it's a value add of membership 100%. So I'm glad that we would keep it within that, but let the consortiums push and market and promote it so that we get more users benefiting from it.
Exactly. This is, I mean, the CDP, I mean, in this sort of cycle of its strategic plan, has really tried to push training and capacity building, and the work that the team, particularly Jamie, has been doing in Tableau has been really a great push in that direction, to get tools like this, to get data into the hands of people that don't necessarily want to go through the catalog, open a Beyond 2020 file, or even a Excel file, and just to have point and click indicators can really make it easy for people to take advantage of what we have in the catalog. So we would like to put more of our catalog into tools like this, but unfortunately we wouldn't be able to share it publicly. As this is, as you put very well, Alison, that this is what we want. This one of the benefits of membership.
Yeah, that's great. Great point, Mike, and good segue maybe to, unless anyone has any other questions for Jamie, maybe we can segue to Allison's presentation.
Sure thing. Sure. So I'm just turning my camera on for a moment, and then I'm going to turn it off because I'm going to share my screen in a quick sec here, and I just find it difficult sometimes when there's all sorts of boxes on the screen. So hi, everybody. My name is Allison Garretts. I work for the town of Banff, small community of about 8,000 people here in Alberta. And I am here today to share our COVID data story with you. And so I am just going to turn off my video, and I'm going to share my screen. All right, so hopefully everyone can see that. Okay, so my role throughout this pandemic, I'm in my day job, have been Director of Community Services with the town of Banff for about 15 years now. But being in a small community, small municipality, of course, we wear multiple hats. And so throughout this pandemic, my role in a disaster emergency response is a Deputy Director of Emergency Management. So I am, so basically I'm here today from that lens to share with you this story. So actually the title of this session actually does make me kind of laugh out loud a little bit, because it implies all along that we approached the pandemic from the perspective that data would drive decision-making. And I'll be totally honest here, we had absolutely no idea when all of this started how much of a role that data support would ultimately have in assisting our local municipal decision makers to make pandemic health-related decisions. So for the first 8 months of this pandemic, our region, which consists of the communities of Banff and Lake Louise, and I'm not sure if any of you have had a chance to come out here, I know some of you have, we're destinations that see upwards of 4 million visitors a year. So small communities, but huge visitation. For the first 8 months of the pandemic, we had a total of 18 cases of COVID. And as you can see here, during the busiest months here in August, we had 0 cases. That led into September as well. And so as a result, our Emergency Coordination Center honestly was not spending any time on COVID data analysis, as there was almost nothing to analyze. In addition, and this might sound a bit naive, but we honestly had not envisioned ourselves ever needing to dive into provincial health data to pull out localized information for the purpose of using it at some point for health-related decision-making. We just assumed this would always fall to public health or Alberta Health Services. During an emergency such as a wildfire, data analysts have always been key people in our ECC because they give up-to-date information to the decision makers to help us make good decisions that protect our community. This is a photo here I'm just sharing. It was taken during a mock exercise a couple of years ago, where I think we're reviewing wind and humidity patterns in this photograph, and we were creating triggers for evacuation notices. Well, in contrast, health-related data was never on our radar during any previous mock exercise that we conducted, even when we talked about pandemic planning. Again, we just always assumed that this would be the responsibility of public health and that we would take their direction. But that all changed pretty quickly when people started looking at the same information and coming to different conclusions. And the best explanation I have for all of it is that politics crept into COVID. And I know this isn't unique to Alberta. Early on, with virtually no COVID cases to speak of, we were looking at data sets from a prevention lens to try to ward off the entry of COVID into our community. So as an example, this very busy, and I apologize for this, graph depicts our daily vehicle volumes at our entrances into town, and it compares them to previous years. So we usually use this information to determine whether we need to actually implement green overrides to flush out traffic congestion downtown on busy weekends. During COVID, we actually relied on this data to give ourselves a sense of what was happening to our visitation trends. So the travel element has been one of the most difficult communication challenges for us during the pandemic. We're a tourist town, and the government of Alberta has never put any formal restrictions in place specific to travel, other than this broad recommendation to not engage in, quote, non-essential travel. But they never really defined what that meant. And so people continued to come to Banff. So in this graph here, this blue line being 2020, during the initial declaration of the pandemic, this was when business closures were in place. We had very low visitation, as you can see here. But as we entered June, we started to notice our vehicular volumes started to creep up. And in some cases, even before the end of the month of June, actually started to match previous year's volumes. And so we saw that as a sign. And in Banff, of course, that means one thing: thousands of people in our small shops, restaurants, and crowded sidewalks. And so to us, this represented a significant COVID risk. And but without the province weighing in at that time with any real limitations on travel, it became an issue for our locally elected officials. So this really marked the beginning of data starting to be presented to council that resulted in public health related policy directions. So at this time, with no provincial directive for masking other than a recommendation to wear masks issued by the Provincial Medical Officer of Health, The town of Banff was one of the first municipalities in Alberta to implement a masking bylaw in July of 2020. We were also one of the first in the country that implemented an outdoor masking requirement in our busy downtown core, which is still in place to this day. Prior to putting that bylaw in place, we actually saw very few people wearing masks, especially in the busy downtown areas outdoors. So I want to show you this before and after photograph, and just to demonstrate how quickly this policy actually changed and influenced behavior. So the photo on the left was taken on the weekend of July 25th, 2020. The mandatory mask bylaw took effect 5 days later, and the photo on the right was taken the very next weekend. So there is not one person in that picture on the right, and I've looked at it many times, that is not wearing a mask. So sometimes all the data you need can be found in a photograph. This picture, we actually shared this before and after many times with both the province, but also with other municipalities to show them what happened when we put into effect this mandatory requirement. And so while other municipalities did end up adopting their own bylaws, including our sister community of Jasper, 4 months later, the province of Alberta still did not have a mandatory mask mandate in place. So we actually felt pretty good about the decision our council made to protect our residents and visitors early on. And it also helped at that time to help normalize mask wearing behavior in our small corner of the province, before Alberta did go ahead and implement a mandatory indoor masking mandate on December the 12th. And for those of you from outside of Alberta, I'm not sure if you're listened to what goes on across the country, but our province has recently signaled that our provincial mask mandate might actually be ending as early as late June, along with all of our other public health measures. So yet again, we're marching into this space where municipal councils may have to have discussions about what other public health decisions they may end up taking, which really has been an ongoing theme throughout this pandemic. Other preventative decisions were taken early on within the municipality, as was the case in other jurisdictions throughout the world. We pedestrianized our downtown Banff Avenue core to create opportunities for social distancing. We hired safety ambassadors to help implement the masking bylaw. And we stepped up safety messaging in all aspects of our communications to potential visitors. And in the end, we actually only saw a drop in visitation of about 16% from the previous summer, which we just thought was unbelievable. And of course, all of this occurred during a time where there were no COVID cases in the months of August and September. Well, and then November happened. So our first large outbreak began after a couple of large social gatherings on Halloween. There were multiple cases at numerous businesses, including hotels, restaurants, and one of the ski hills. And due to, at that time, overwhelmed contact tracing in our province, many other publicly unreported outbreaks that occurred. And although many of you who are probably looking at this from large urban centers are looking at the numbers and thinking, well, that doesn't sound like a lot of cases, we quickly in the Banff area moved into the highest per capita case count in Alberta. Many of our businesses ended up closing their doors just because so many of their staff were impacted either through infection or close contact designation. So although the COVID hotspot moniker wouldn't be the only time during our COVID journey that this would be the case, this is sort of a plotting of our active case rate throughout the pandemic. And the time I'm talking about right now is this first one here, this first spike. This original spike here was the time that our ECC really started paying close attention to whatever COVID data we could get our hands on in order to give our council and the community the most accurate picture we could with regard to the evolving situation. So we did declare a state of emergency because of the rise in case counts, but also because of the concerns we had at that time about contact tracing and local data reliability. We believed at that point that undercounting was a significant issue during this period, given what we were seeing and the cases we had awareness of due to that small town living that we're a part of here. And we knew there were more cases than what were being reported. So this is where, and this was an interesting moment, because this was the time it became apparent to us that even though our emergency plan always identified health as the lead agency in a pandemic, we realized we needed to start to rely on our own situational awareness in order to track, make local decisions, and to advocate for appropriate resources. So my days during this time were spent tracking cases from the local business community and feeding that information directly to the disease control teams at Alberta Health Services, because they were just completely overwhelmed. It was absolutely an unprecedented time, to say the least. So these news headlines here, they really highlight what was happening back in November leading up to Christmas. The province of Alberta was reluctant to bring in new restrictions as the case counts were rising. And as a result, again, local government felt that they needed to, at least in Banff, began to contemplate their role to address what was happening locally while continuing to advocate provincially for widespread restrictions. So we began in Banff with the suspension of indoor team sports in our rec center and other indoor programming. And that followed with a very bold step by our council to enact a bylaw, which actually reduced occupancy in bars and restaurants, as well as limiting the hours of operation of liquor stores. And these decisions were made with support from the data that council was being presented with at the time. Some of it was public, but much of it was in camera at that point in time. Our municipality took its own steps to create municipally operated isolation spaces, which helped by providing much needed local isolation options to people living in congregate settings in our community, of which there are many. Sorry. Oh, was there a question? Oh, never mind. And by sharing the data we were collecting with provincial officials, our advocacy efforts were ultimately successful in receiving provincially operated COVID testing in town and in obtaining provincially designated commercial isolation space, both resources that are still in place to this day, actually. About 13 days after the town of Banff's business restriction bylaw was passed, the province of Alberta did end up enacting broad sweeping restrictions that did end up superseding what we had put in place. And as a result, we ended up having a super quiet Christmas with very little visitation. I apologize for the quality of the photograph on the left, but this is just so you can see the impact, the side-by-side photograph taken on New Year's 2020 as compared to New Year's 2021. So as you can see, our town was virtually empty. And our COVID journey certainly did not end there. We got through Christmas. We had low case counts through January. In this section right here, the gray is our active cases. It's reflected over here as well. A little blip in February, and then the situation we experienced in the fall repeated itself again in the spring. And in April, we had another large spike in cases. And this graph here on the left, it's been used to track our COVID story all along. I mean, from the time that we started tracking data, which was in early November. And for our small health region of about 10,000 people, you can see as of yesterday's released information, we've had 802 cases since the pandemic began. And as you can see right now, we're currently sitting at 3 active cases. During the wave we just got through, we were actually able to respond quite quickly this time around because of the experience from the last wave, and we were able to scale up the resources that we needed. So testing and isolation spaces were ready at this time for immediate deployment, and council responded pretty quickly by directing us to enact messaging for potential visitors to stay home with a save our summer kind of messaging until we got our situation under control. And then the province did eventually put in place restrictions again. And so this time the municipality did not end up having to enact additional measures other than that messaging for potential visitors to stay at home. So throughout this pandemic, the Banff ECC has presented a COVID pandemic update as a standing council agenda item since going back to the spring of 2020. And this update grew to include a series of data graphs depicting our daily tracking of COVID related info. So include the total cases, recoveries, active cases, weekly cases diagnosed, our active case rate per 100,000, including and weekly testing numbers as well. Some of the information was pulled from the Alberta provincial website, some from the federal website, others from actually info taken from local doctors' offices and the hospital. And all of this was done to ensure we were giving council the best sense of the local situation to position them to make the best decisions they could. Visualization of data was really important during this period of time as well, especially when it came to the active case rate. Small communities tend to look at things, and even larger communities would look at the case rates in Alberta, visitors, for example, and not really understand the severity of the situation we were dealing with. So we felt it was helpful to really highlight the active case rate per 100,000, which is a real equalizer in terms of explaining the situation we were in as compared to Alberta, which was, already in the spring, for example, with the highest in North America. Well, look at the rate that Banff region was at. We were significantly high in comparison. And finally, we've just recently been able to add to the COVID update the vaccination rates in our community by age. And so this has obviously been a very hopeful addition to our standing presentation to council. But this information is also going to help with decisions on where, how, and when to promote vaccination locally within our community. So having a handle on who is getting vaccinated, and especially once we start tracking the fully vaccinated metrics. And while, I'm not sure how long any of this type of reporting will continue, so long as it assists our council in understanding the impact of this pandemic on our local community, we'll keep presenting it. We've learned without a shadow of a doubt that the acquisition and presentation of local COVID-related data has been fundamental in terms of the role it's played throughout our municipality's pandemic response. And so with that, I'll end there, and thanks very much for your time.
Thank you, Allison. Feel free to use the chat box if anyone has any questions for Allison. I was really struck by the correlation between low case counts in the summer and the mandatory masking. That was very impressive. And it really goes to show how taking a data-driven approach works, especially in regards to COVID. Going forward, how do you think, how does the town of Banff plan to use data to kind of roll back some of these restrictions as vaccination rates increase and we look forward to the summer?
Mm-hmm. Well, and I think the town, right now, this is a very interesting conversation in our province anyways, because our province has announced quite an aggressive relaunch plan that could see us without any restrictions in place as early as June 29th, potentially, which for many people, it's a pretty overwhelming, in terms of thinking about that and so I think one of the pieces that we will be looking at very closely, one of the metrics that we'll continue to watch is that double dose vaccination metric, because it is very possible that our council could, as they did before, put in place measures that are maybe more restrictive than what the province is suggesting, but tying it to double doses for vaccinations as opposed to the single dose approach. But again, none of these things are done so without controversy. And so it's balancing as elected officials. My job is easy. All I have to do is sort of give them the information. But for them to sort of wade through it and make decisions that are, oftentimes in contrast to what's happening at our provincial level, it's a tricky situation to be in for sure. And I don't envy them the difficult choices that they have ahead of them.
Yeah, Mary has a question in the chat kind of related to that. Do you think that council will continue to look to data in the future based on their experience from the pandemic?
Our council has always been very, they love data. That traffic example, they have reams of information that they're looking at to try to make decisions. I guess the piece for us here in this context was we just didn't understand the role, and I don't think anybody did. We weren't the only municipality in Alberta that made policy decisions tied to COVID that went beyond the province. We weren't the only ones. But I think, the realization that all areas, sometimes you need to look at, everyone wants to make decisions based on good information, but it wasn't always our information. We were looking at provincial data. And so having to sort of put the context in to really filter it through so that our local community and our decision makers could understand the impact of the situation we were in. Yes, I think they'll always rely on data. I think it's just the lesson learned here is that, you can never really go on the assumptions of who's going to be making decisions for for what purpose? And in public health was just not something I don't think anyone running for office ever thought they'd be making decisions specific to, for sure.
Yeah, thanks. And Mary just has a follow-up saying, great job of showing eyes on the street and needing local data.
Yeah.
And then there's another comment just commenting on your great use of photos as data. I think we all appreciated that kind of before and after of the mask. It's a really powerful photo.
And I guess the only thing to say to that was, you know, everyone we had talked to before our council made that decision of putting in that mask mandate was, well, you know, if people aren't following a recommendation, why would they follow a bylaw, you know, or if you can't enforce it, what's the point? You know, you hear these things all the time, and our assumption and our hypothesis was Canadians, generally speaking, you know, the Bowden rodeo folks aside, are generally rule followers, you know, and that was the case, you know, and with the safety ambassador at the edge of Banff saying, hey, everyone, it's a mask, you have to wear your mask here. We got virtually no resistance from it, and everybody ended up following the rules. So it was a great visual image to show, to say, don't be afraid of doing this because people will get on board.
Yeah, it sort of normalizes the behavior of mask wearing too. Once other people see other people wearing masks, then it becomes normal.
You bet.
There's another question in the chat wondering how the city or the town of Banff accesses data on ridership.
Yeah, for transit? Is that?
Yeah, I would
yeah, and our ridership has just gone, it's just imploded. I mean, it's terrible. You know, I think our transit ridership per capita is one of the highest anywhere, because it's the transit system has been designed predominantly for tourists and visitors, you know, and the locals get to benefit from having great transit. But in a town of 8,000, we wouldn't have the system we did if it weren't for those 4 million visitors a year. But we have our regional transit authority has a tracking system. It's all automated with a tap, so we know how many people are getting on and off and total ridership, and it is you know, the last information I saw, it was down 90%. It's a significant impact the COVID has had on it, and I don't know what will happen this summer, because I'm just not sure, even though people are being told that they're going to be able to go back indoors in Alberta anyways in a very short time here. I don't know. It'll be interesting to see whether people feel comfortable doing that or not, especially if there isn't going to be a mask mandate to go along with that. So we'll see what happens on that regard. But, you know, hopefully it bounces back, because it took years to get to the high ridership levels that we were seeing in Banff.
Yeah, it'll be interesting to see how it all plays out. I feel like a lot of towns and cities are facing that, particularly with transit ridership. I have another question. Are you looking ahead to the summer 2021 tourist season with like specific data points, or working with tourism providers in the area to kind of understand what that might look like?
Mm-hmm. So we made a decision early on that we were going to replicate our pedestrian walking area in the downtown core. So we've made that plan. We had that plan all along, and you know, one of the positives from COVID is that we might very well convert Banff Avenue, you know, permanently for the summer months into a pedestrianized zone, which if the pandemic hadn't occurred, I don't think that would have happened this quickly, because, you know, for years we've been hearing about how people need to have people driving by in order to not impact their businesses. But the business community this time came out in droves asking for this to happen. So that is in the works. And we're in constant communication with our tourism destination marketing organization. They work with us in our ECC, and they're getting a sense that there's, you know, we're going to have high visitation again in Banff this summer. There's no reason to believe. I mean, last summer, you know, during the height of the pandemic, no vaccination, you know, in the works, and you know, we only had a very minimal sort of dip in terms of people. Now, not all those people were spending money the way that previous people were. A lot of them were day visitors, but still, we expect to have a very busy summer, and you know, I guess it remains to be seen sort of what that will look like overall, but we're already getting preliminary information around booking intentions for hotels and things like that, and it's picking up for sure as we get closer to July.
That's great. I think there's just a follow-up question, from the question about transit ridership. What were the internal capacity to advance the data manipulation and knowledge transfer function, and the number of staff, I guess, used to kind of understand transit ridership?
Okay, well, the transit data that we get is directly from the transit authority. So they have, I mean, and I apologize, I don't know enough about how they do it, but it's an automated system in terms of the tap system. So it comes to us in the data is already developed there. So I can't really comment much more on that. And I don't know what the number of staff means. Is that number of staff to interpret the data, or?
Does that answer your question?
Oh, sorry, I meant for data on COVID that the town used. Oh, okay. So the data that we used for the town, it came from the province of Alberta's sort of reporting system, but we captured it on a daily basis for a local context. And you had to do that because provincially you can download the provincial information, you know, in a big spreadsheet, but locally that information gets sort of published each day, very high level. And so we did our own analysis, sort of tracking sort of the daily information so that we could present trends over time. And that was one person who did that. And that was me. So we're a small town.
Great. Yeah, I think that answered the question. Is there any other questions for Allison?
Thanks very much.
Yeah, thank you, Allison. Okay, well, thank you, everyone. Unless there's any more questions for Allison or Jamie or any of the other presenters today. Oh, Perna is just saying that she is leaving to another meeting. So thank you very much, Perna. We all learned a lot from your presentation. So that concludes our webinar today. We are hosting, the CDP is hosting another webinar next week, which is an orientation to the CDP and the Community Data Program more generally. So if you would like to attend or have maybe some other interested members, registration will be sent around shortly. So lots of thank yous going on in the chat. So thank you very much, everyone, and enjoy your afternoon.